Good evening, everybody. Thank you so much for being here. I would first like to start by providing a land acknowledgement. I would like to begin by acknowledging that the land on which we gather is traditional, unceded territory of the Algonquin and Anishinaabe people. The Algonquin peoples have lived on this land since time immemorial, and we are grateful to have the opportunity to be present in this territory. My name is Clarissa Arthur, and I am the Executive Director of the Education Foundation of Ottawa, and I am the Chair of the Infant and Early Childhood Mental Health Task Group. I'd like to thank you for taking the time out of your busy schedule to join us tonight, and I would also like to introduce you to another task group member, Michelle Krogi, who is the Manager of Children and Family Services with Pinecrest Queensway Community Health Centre. As you had noticed in the chat, we wanted to let you know that since we are in webinar mode, you are unable to unmute yourself. So please, if you have any questions, put them in the Q&A chat feature. First, we would like to play a short video to provide some context to infant and early childhood mental health. When we first started this work, we came across a number of people who just didn't get the concept of infant and early childhood mental health. So I hope that this short video helps put the idea of what we will call and refer to IECMH into context for. Thank you, Karen, for playing that video. You know, in order for us to share information about the Infant and Early Childhood Mental Health Task Group, I think it's important to share information about the Ottawa Child and Youth Initiative, or OCYI, which we exist under. So OCYI works collaboratively with about 80 community organizations, and they all have the same goal. That goal is to ensure that all children and youth in our city can reach their full potential. These collaborative efforts allow us to be able to do things like plan and guide and influence change within our own organizational practices, within the larger systems, and then again within public policy. So with a focus on early years from 0 to 6 and school-age children from 6 to 12 and youth from 12 and older, we all work together across the age spans to achieve our goals. OCYI, if you may not know, has 5 different task groups that focus on identifying priorities, strategies, and making recommendations. And we each develop action plans, we monitor our outcomes, and we work together to engage and mobilize others that are interested in investing in children and youth within our community. So in addition to the Infant and Early Childhood Mental Health Task Group, there's also task group for early childhood development, critical hours, the Ottawa Collaborative for Parenting Support, as well as one for research and evaluation. If you would like to learn more about OCYI and its activities, you can of course take a look at their website at growingupgreat.ca. So now that you know a little bit more about OCYI, I can share more information about our Infant and Early Childhood Mental Health Task Group. IECMH came together probably about 7 years ago when we realized as service providers that we were actually doing this important work of ensuring that children had an environment that supported a healthy mental state. But we also recognized that we didn't necessarily have a name for it. With that, we realized that we ran the risk of having disjointed messaging, and we know that that can be a problem when working with vulnerable populations. So together, a group of us formed this professional table so that we could create consistent messages around infant and early childhood mental health that was inclusive of a number of different factors, including the prenatal and perinatal phases, as well as considering the context of one's family and greater community and their culture. Our goal is to create opportunities for education and awareness on 6 major aspects of infant and early childhood mental health, and they are attachment, temperament, self-regulation, sense of agency, brain development, and resiliency. One of our major projects, and you can see here from the image that this is our logo for the IECMH table. And you can see that in the middle, it has the perinatal, prenatal context, as well as the number of different components that I mentioned. And you can see that all of those are include the culture, family, community, and whatnot for the family. One of our major projects has actually been the Practice Change Champions. And if you are here, it's probably because you have participated in the past or you have some kind of interest in learning a little bit more. So with that, I'll pass it over to Michelle to give you some history on the Practice Change Champions.
Hi, everybody. So we're going to start with a little poll. We were just interested in knowing, out of the people who are here tonight, did you previously participate in the Practice Change Champions? So you should see a poll pop up on your screen, and I'll just wait a few minutes while you answer that. Yes, no, or not sure. And I think that I can't see the answering, but I think that Karen will let us know. There we go. So we have a large percentage who are not familiar with the Practice Change Champions, and a small number who are, and some who are not sure, which is fair enough because a lot has happened. I think the timeline is similar to when the IECMH group formed. So the first Practice Change Champions was started in about 2015. And the goal of that was to provide training and education for professionals working with young children and their families in the community on the promotion and prevention. And the goal was to strengthen overall professional capacity and build community awareness on the importance of mental health and in the early years. So we wanted to have providers like yourself to have a same baseline of information and to become a champion at their agencies to continue to move forward with bringing the important information of supporting early mental health. So there'd been two cohorts of the training in the last 7 years. And some of the things that we did were reaching in and reaching out, building resiliency training, some of the self-regulation models from Dr. Stuart Shanker, Making Sense of Preschoolers by Dr. Gordon Neufeld, and infant and early mental health promotion modules that were through the Sick Kids in Toronto. So the cohorts did a combination of in-person and online training, and they participated in learning labs, community of practices that supported the learning material along the way. So that's a little bit of the past, and as you can see, there's a lot of new people here. So really what we're trying to get an idea of is the pulse of what is some next steps, and what does the community want, and we've come a long way in the last 7 years, understanding the importance of infant and early mental health, and how can we continue to support each other as colleagues and move forward with this goal. So I'm going to pass it back to Clarissa.
Thanks, Michelle. So if you did participate in the Practice Change Champions previously, you most likely would have received an email survey asking you for some input on some topics of interest. And you can see here that the top results from the survey, we're just going to pull this up on the screen for you to be able to see. When we asked these topics when we asked this question to past participants and they responded, they did say that trainings that would be supportive of their practice would be information around working with specific vulnerable populations, trauma-informed care, self-care, wellness, attachment training. So they did give an example of something like Circle of Security. And then as well, another answer was vicarious trauma and compassion fatigue. Now, I'm sure that in working in the field, every single one of these would be an area of interest for you. But maybe what we'll do is we will pull up another poll, because you never know, if you had answered the question before, your answers may have changed. And since we did have a number of people who did not participate in the Practice Change Champions, you would not have been asked this question before. So we're going to ask it now. So when you think about the type of work that you do, what one of these areas would make sense for you if you could pick 3 that you would be interested in learning more about? And again, if you could just take a second to pick your top 3, please. Perfect. And I think that once the answers are tallied, Karen will be able to share that on the screen for you. Wow, okay. So we can see here that, of course, working with specific and vulnerable populations is one of the top answers, and that makes great sense, as well as trauma-informed care. I have to tell you, as a professional, when I started learning about what trauma-informed care was and how to be able to work with the populations that we were serving, it was a great area of interest for me. And then as well, self-care and wellness is obviously something that's very important, because we have to find that balance too. But I do see that attachment training, circle of security kind of came in 3rd place. And then vicarious trauma and compassion fatigue, which kind of falls in line with self-care and wellness as well. So thank you very much. So this information will be important for us as we plan the direction of this whole Practice Change Champions initiative. And maybe what we'll do is I will pass it back over to Michelle to talk about some potential opportunities for learning in the future.
Sure. And I might get you to jump in a few times, Clarissa, if I lose my way here.
No problem.
I think like Clarissa said, I'll just echo what she said. All of those things, we are so important. And as you could see, the percentages, they're very close as far as what people are interested in. And so the top 3 that I quickly noted was vulnerable populations, trauma-informed care, and attachment training. So some of the ideas, that the working group has thrown around as possibilities, and we're wanting to get some more feedback from this group and heading into the future, is what could that look like? So we. So some of the trainings that we have done in the past, we understand that everybody's time is very precious, and a lot of these trainings have a big time commitment. And so wondering, what kind of focus, if we look into just ahead into 2022, what could that look like? And so one of the ideas we threw around was a possible, like a community of practice. And I'm not sure if all of you are aware, but the IECMH did create some tip sheets that are on the Growing Up Great website, as well as Ottawa Public Health website, that have to do with each of our circles here in this graphic. So you can go onto those websites and you can get that information, and they're great tip sheets. There's tip sheets that are for parents that you can share with your families, as well as there's tip sheets for you as care providers and how to support families with temperament and self-regulation and learning all of those types of things. I see Karen's put the link in the chat for you. But one of our ideas was, do we want to explore those, or would people be interested in taking a little bit of a deeper dive and exploring some of those tip sheets and the resources on there, and then having some real genuine and conversations around that, and how do we support families. And sometimes it's tricky to find our words when we're trying to explain ideas and things to families. So is that a possibility? um, there's also additional, sort of mini trainings that we, trauma informed care. Some of you might be familiar with the brain story training that Alberta has put out, which is a very long, and we know it's 30 hours in total. But there's also some little pieces they've done around trauma informed care. So, would it be interesting if people are able to, watch one of those hours on their own, and then we come together and discuss it? Or do you want to watch it as a group? Or so what kinds of things, like how best would you like to learn that information, or like to share and spend time with your colleagues in diving into some of that information? We recognize that, everyone is tired, and so we know that everybody learns differently and takes in information differently. So kind of what works for you, and we want to be able to be supportive to the community, and moving these ideas forward and keeping it alive. And we know that we keep hearing, especially now through COVID, the trauma that's come out for families, and children, and sort of the long-term effects that those are going to have. And we want to make sure that we feel prepared to how do we best support the families and the children that we work with. So those are some of the opportunities. Did I miss anything, Clarissa?
No, sorry, there's my video. I think that you covered them well. And, I think the other reality is that when we did do the Practice Change Champions, both cohorts a number of years ago, our capacity has changed. And so that means that the format of Practice Change Champions has to change too. But the work is so important. So I think it is, it's a priority of ours to be able to find options and ways for you to still feel engaged and to learn the things that you need to learn, but to provide different opportunities. I know that when we did the Practice Change Champions before, it did require people to have time off work and have replacements. And we, met at one spot, and we did a number of conversations together. But we've moved into this virtual world with sometimes it has its downfalls, but at the same time it does have its benefits too, right? Because we can get together without having to leave our homes. So we wanted to be able to provide you with a number of different opportunities so that you can kind of say to us, this is the way that I learn best, and this is the way that I would like to participate moving forward. At the end of the day, the idea of the Practice Change Champions is to be able to come together and to learn those consistent messages, and to be able to take that information and to weave it into our work. So because we all come from a number of different areas within the sector, I think it's important that we're versatile in the way that we deliver the information, the way we receive the information, and also the way that we disseminate the information in our organization. So if you guys wouldn't mind just taking a second to answer again another poll, we'll be able to put that up on the screen so that you guys can choose which options make most sense for you.
We recognize too, there's not a section here to if you have any other ideas, but please feel free to write them in the chat. You know, these are just 4 sort of ways. You know, and like we said, we recognize that everybody learns differently or different things work. So if you have had an experience that really works for you, think would be a great idea, we'd love to hear it. So please put that in the chat.
Right, and hopefully we can see the results. So let's see. Okay. So I see here that the majority have answered that discussion groups focused on specific trainings is of most interest. And then also community practice, which I think is excellent, and discussion groups and recommended training. So you guys just want to do it all. That's what I'm realizing here. And I really, I like that idea because, you know, the reality is that, like I said, we really want to be able to push this initiative forward as a task group. We do meet every single month. Once a month, we have a meeting, and I can tell you that we talk about Practice Change Champions and what are our next steps at pretty much every single meeting. So this is exciting to me that we have over 50 people on the call who are interested, engaged in participating in the Practice Change Champions and creating real change and impact in the community.
Yeah, that's great.
So,
and it looks like people definitely want to connect with the top 2 ideas of discussion groups and community of practices. So that's really great to see as well. We know we had about over 90 people registered for the event, and it is being recorded. So the other people that weren't able to make it tonight, hopefully they'll be able to have a look, and they will also get an opportunity to send us feedback. So we'll be able to look at that as well.
Thank you. And so, Karen, our technical guru, I know that you are monitoring the questions. So I just wanted to know, do we have any questions from the group? Because Michelle and I are just so efficient with time and want to be able to give you your evening back. I can see that we are going to be ending early.
No questions.
So, okay. Perfect. So just to, so maybe we can just summarize. So tonight we were able to give you an overview of the Ottawa Child and Youth Initiative, as well as the Infant and Early Childhood Mental Health Task Group. And it's described a little bit about our work. And Michelle was able to share with you some information about the history of the Practice Change Champions and the purpose of that initiative. We also were able to connect with you and to share the results of our past survey that we sent out, and also to hear from you about what topics you are interested in and how you want to learn about those topics and how you want to engage with us as a group. So our thoughts at this point is that we would like to follow up with post-event survey and to provide you with some additional resources that may be useful in your work in the meantime. Then the idea is within the next 2 weeks or so, our plan is to have some additional dates for you for us to connect in the future. From a capacity standpoint, what we were thinking was that we would meet every 2 months. So if we're November now, you can expect that we would be looking to meet again in January. And if anyone has any other feedback, you'll be able to provide it, of course, in the post-event survey that will be shared with you via email. Okay.
That's great. No last minute questions, thoughts, or comments in the chat.
No.
I think it was really helpful. I know it was super quick, and we appreciate you taking the time to come online, but it really helps us to look at the direction that the community wants to go, and to start back into this great work and making sure that that we're we're spreading it around the community. So if you also have colleagues, that are interested in joining later on, please share the information, share the emails, and that's great. I think that's it then, Clarissa?
Yeah, that is it. Thank you again so much, guys, for taking the time out of a long work day. I know it's dark in the morning, it's dark in the evening. And so
Sure.
it's extra tough to have a commitment like this. So we really do appreciate you taking the time, and we look forward to meeting with you again.
Great. Have a good evening.
Perfect. Thanks, everybody.